Good afternoon. We're here to update you regarding the city's COVID-19 response and the COVID-19 situation here in Nashua. Right now, we have about 1,000 cases. We've had about 1,000. Active cases right now, meaning people who are still being treated, 93 cases, and they have had 166 contacts. So our public health department is working with everybody that a positive case has been in contact with. But we're doing relatively well. If we compare our experience to some of the equivalent cities around us, Manchester, Lowell, Lawrence, we have far less cases. Now, we've been very cautious. City Hall has been closed, or at least partially closed, for quite some time, and I'll get into a few of those details in a minute. But we need to continue to exercise caution. And Bobbie Bagley, Director of Public Health and Community Services, is here to talk with you about some of the safety measures that we need to continue to take. But I can say from personal experience that the disease, COVID, can come in unexpectedly. So what happened with me, and I became a COVID positive case, I had COVID-19. What happened with me is I was being very careful from March all the way through. Didn't go out very much, really careful about crowds, wearing a mask and all that kind of thing. But on a few occasions, I attended or held a meeting here in City Hall with a very few people. So on a Monday and on a Wednesday, here in City Hall, in a conference room with a huge conference table, I met with about 3 other people. Everything that seemed to be no problem, a small number of people, we were socially distanced. But after the Wednesday meeting, on Thursday afternoon, one of the people who had come to the meeting called me and said, my daughter, with whom we live in the same household, my daughter tested positive for COVID-19. That's what he told me. And I thought about it for a moment, and I said, well, then you and I need to get tested, because we might have been exposed. Now, I didn't really think I had the virus, but I thought it was certainly a cautionary measure to take. We got tested. The co-employee tested positive, and my test came back on Saturday and tested inconclusive. Well, I talked with Bobbie Bagley, Director of Public Health, and she told me inconclusive means probably you have it. Now, at the same time, my wife had been tested, and initially she came back negative. So I was retested, 2 different tests on Sunday. They got the test results back quickly on Sunday afternoon, and I tested positive on both. So now I had COVID-19, and I could begin to definitely feel the symptoms. It was like in my case, it was like having the flu. Muscle aches, headaches, nausea, just tiredness and weakness. But fortunately, lucky for me, I had a relatively minor case because I did not have a fever, and the symptoms only lasted 3 or 4 days. But again, I could definitely feel them. Now, my wife had a different experience. She tested positive a little while later, obviously having caught the disease from me, and she lost her sense of smell, a lot of weakness, flu-like symptoms. She also did not get a fever, but still now, like a month later, a little bit more, she still has a loss of smell and still has a little bit of tiredness. But again, her case was relatively mild compared to some of our neighbors and other people in Nashua. We have a neighbor who, unfortunately, is one of the 39 people who in Nashua has passed away. And that's 39 families who have been definitely adversely impacted. They've gone through a lot of grief. It's very difficult to lose a loved one to COVID-19. It's hard to visit in the hospital. So this is not a disease that anyone wants to get. Now, the point of my story is that, look, this thing can sneak in ways that you never expect. In the couple of weeks before this outbreak, now in City Hall, this resulted in 5 other people. So it was a total of 6 cases, 6 people in City Hall. And this shows you that the disease can sneak in ways that you never expected, because none of us ever expected that under the circumstances we were working that COVID-19 would ever find its way into a City Hall meeting. So you need to continue to be cautious. Now what we've done, wear your mask, social distancing, be careful about groups, just exercise caution. What we've done in City Hall is initially, back in March, we were closed and we're handling automobile registrations simply by appointment. Then, and voter registration the same way. Then we opened up in part. We began to allow people to come in for automobile registrations on a kind of an appointment basis. 5 people would come in, 5 people would be waiting, and we would rotate that throughout the day. For voter registration and a few other functions, people came in by appointment. Or for voter registration, showed up at the back door of City Hall on Elm Street, and the city clerk took care of the voter registration function. After the outbreak involving me and the 5 other people, we had to close City Hall again because it had already spread to some degree, and we didn't want the public to be infected, and we didn't want this to get more widely spread among employees. So we closed City Hall then again for 2 weeks, handling automobile registrations remotely and any voter registration or other voter issues outside on a table right outside the city clerk's office on Elm Street. Now, as of about a week and a half ago, we reopened City Hall on the same basis that we were before. We're letting people in 5 at a time, 5 waiting to do automobile registrations. Voter registration is taking place over at 14 Court Street, right between the library and the old fire station. Now, you're going to hear from Bobbie Bagley, who is the Director of Community Health, regarding more details regarding the city's COVID-19 situation. And you're going to be hearing from Sue Lovering, the city clerk, regarding how we're handling all the absentee ballots and absentee ballot requests that we're receiving regarding the November election. And certainly we want everyone to vote. And how we're registering new voters. Most of this activity is taking place as I said, over at 14 Court Street. One more thing I wanted to mention before I turn things over to Bobbie Bagley. We will be holding Halloween on October 31st. That's a Saturday night, but we want you to be careful about how this is handled at each household. And Bobbie will talk with you about some of those details, how this should be arranged, but we want to not to have kids reaching into bags, a whole bunch of candy in a bag or in a basket or anything like that. Kind of individually parcel out the candy, because we don't want the virus to sort of get on a surface somewhere and spread among all of the kids. So with that, I will come back to tell you about some events that are coming up, but with this, I wanted to turn this over to Bobbie Bagley, Director of Community Health. And in doing so, I want to state again that Bobbie and her staff of public health nurses have done a great job for the city of Nashua. They have worked with all of the positive cases, all the people who have contracted COVID-19. They follow up with them. They then trace all their contacts, make sure that people quarantine to limit the spread of the disease. So we've been very well served by our public health department, by Bobbie Bagley, and by our community health nurses. And we are social distancing here, so Bobbie's going to step up after I step away. But this is, you'll now hear from Bobbie Bagley.
Thank you, Mayor. And I'm very happy to see that you are doing well and that you have recovered from your illness, and also glad to hear and know that your wife is also recovering. And as the mayor said, this virus does not discriminate against anyone. It doesn't choose individuals based on anything other than the fact that as a virus, it needs to survive and it needs people to survive. So what I'd like to do is to give an update of what we've been seeing globally, nationally, here in New Hampshire, as well as what we're seeing in Hillsborough County and Nashua. So globally, right now, this pandemic continues to spread. Over 35.8 million cases have been identified since the start of this pandemic, with deaths reaching over 1.05 million across the world. In the United States, we've had 7.5 million cases with over 210,000 deaths. 210,000 lives have been lost as a result of the coronavirus. In New Hampshire, although we may not look like many other states across the country, COVID has impacted us in ways, again, that we need to work to continue to do our best efforts at mitigating and stopping the spread of this infection. We've had over 8,731 cases. We've had a nice recovery rate. 89% of those who have been infected with the virus have recovered. We've seen a 9% hospitalization rate. And again, these numbers don't look or sound too alarming, but they're still significant with the disease that we can stop if we take the measures to do so and take personal accountability to making sure that we watch out for our neighbors and ourselves. We have experienced a 5% of those who have been infected with COVID in New Hampshire have died. And again, our sympathies to those families for those who have suffered that loss. In Hillsborough County, we've had 4,681 cases and 294 deaths. Nashua has experienced and has been experiencing for the past month an increase in cases. At this point, we've been averaging about 8 cases per day, and this has been impacting the work that we do over at the health department. And in fact, if you've seen on some of the updates, Nashua has been identified as having substantial community transmission, and that's based on a metric that has been identified by combining new cases with new hospitalizations and with our percent test positivity rate. Now, our hospitalization rate has been down as well as our percent test positivity rate, but we still continue to see new cases and we still continue to see increased contacts to each one of those cases. As these cases continue to come in, we look at, in our investigation, why? What's going on in Nashua, the reason why we continue to see these increases? Well, we know that activities and businesses, restaurants, our schools, and sports activities have been able to increase because of the opening up of our state. And those are things that we expect and we wanted to be able to do to encourage the economic rebuilding in the state, and that's going on across the country as well. And so when we do these things, we also know that there is a risk for increased exposure when people are gathered together in crowds or in large settings or with individuals that are not a part of their households. And so with that, we continue with our messaging around social distancing, around the importance of wearing our masks, because we know that the mask can reduce the spread of infection, my droplets being spread from me to someone else. And if we're all wearing our masks, we know that we reduce that exposure greatly. As far as the situation update for us, what have we been dealing with over at the health department? Those increased cases. Some of them have been with individuals, and some of them have been based on activities that are happening, dealing with sports, activities involving churches in our community, as well as in cases that are related to small cluster outbreaks, as we discussed with here at City Hall. So with those investigations and those outbreaks, we continue to work to identify contacts as immediately as we can. And so our goal with that is to help people understand and know what their risk can be, but we also need for people to work with us. We need people to collaborate with us. So when a public health nurse calls and wants to talk with you about a positive case or your exposure to a case, we would like for you to cooperate and work with us, again, so that we can get those measures in place for isolation and quarantine. A big part of what we do is education. And so we want people to understand their risk as well. And our community has been doing well, and we want to continue to do well. We do need to continue to bring those numbers down. So we have created on our website at www.nashuanh.gov under COVID-19, under the Community Health Department, we've posted a graphic that shows risk level for activities. Because again, we do want people to be able to enjoy themselves in the community. The weather is nice, the fall foliage is coming in, but we want people to really take a look at what activities will create the lowest, the highest risk for them as they engage in those activities. So please take a look at our website and take a look at that chart. Anything that's done outdoors, we consider that low risk. If you do outdoor activities and you spread yourselves apart, engaging in safe social distancing, that keeps that risk low. Things like grocery shopping and outdoor dining are considered low, moderate risk activities because there's more people that are there. But again, as long as we're wearing those masks and maintaining as much social distancing as we can, we reduce exposure to this virus. More moderate risk may be related to backyard events and also going to hair salons, nail salons, and barbershops. Again, because it's closed in those areas, and there's opportunity again for greater exposure. When we think about moderate to high risk activities, these are activities that bring us indoors, where we're in settings where we can be closer to one another. Those are going to be the activities that are going to increase our highest risk. And we want people to really do their due diligence and be vigilant about their mask use and social distancing, washing of your hands when you're in these settings, and also making sure that if you're sick, that you don't go out at all. Now, what does that look like? Because in some of these cases that we've been investigating, some individuals don't have really symptoms that they might determine as I'm feeling really ill or I'm feeling really sick. They may be really, really mild symptoms, but we're asking people to think about our situation that we're in with this COVID pandemic and to be mindful of those, even those mild symptoms can actually be a result of COVID. So we're asking people to also get tested. We're asking people to stay at home until they get those results back. And if those results, again, come back positive, we're asking our community to work together with us so that we can mitigate and get the measures in place that are needed. The mayor mentioned Halloween. This is an activity that many of our families in our community and children are looking forward to engaging in at the end of the month. And we want people to have a safe Halloween. We want people to engage in this activity in the safest way possible. And so again, going to reiterate, if you're feeling ill or your child is feeling ill, please don't engage in the Halloween activities. Whether they're activities that are done at home in someone's backyard, we're asking individuals if they don't feel well to please stay at home. If folks do decide that they are going to engage in Halloween activities and they're going to go out into their neighborhoods, we're asking people to stay with their family units. And so smaller groups of individuals that you know. Avoid large gatherings. It can get complicated if there's a large number of kids that are all joined up together and going up to a door to get candy. So we're really trying to discourage that. We want to do it differently this year. Make sure that you can maintain a safe distance of 6 feet from other groups. And if you're going to hand out candy, what we're asking is that is done differently. Maybe set a table out in front of your house or in your yard and put bags on the tables, and so that the children aren't reaching into a bowl where all hands are going in together, but they're picking up an individual package of candy. Be creative. We're also asking people during this time, again, to wear their face coverings. The masks that people may have on, the Halloween costume masks, are not a substitute for the surgical mask or for the cloth face coverings. And we're also asking people for safety to not put the face mask underneath a costume mask. I saw a really interesting mask at one of our testing clinics where the individual had their Halloween decoration right on their face mask. So again, it gives us an opportunity to be creative. As you engage in these activities, and we know adults as well as children enjoy some of the activities around Halloween, practice frequent hand washing. Make sure you use hand sanitizer. Have hand sanitizer around if you're going to set up the tables and you're going to be interfacing with individuals. Make sure that you use a hand sanitizer, especially when you don't have the opportunity to use soap and water in between. And to kids, as you go home, make sure that you wash your hands before you dig into your bag of treats. And for those, if you're going to have costume parties or any type of events like that, again, be mindful of safety, be mindful of the risk of those activities. And again, we're asking, if you're ill, if you're sick, please do not engage in those activities. We do have and continue to have upcoming testing clinics in Nashua. We are offering these on Tuesdays in the Elm Street garage across from the Transit Center. We do this from 3 to 5 p.m. and we do encourage, again, people to come out to get tested. If you feel like you need to check on symptoms that you're having, please do come to the clinic. You can register online on our website at nashuanh.gov /COVID-19, or you can call us at 589-3456. That's 603-589-3456. Our recommendations. Yes, it is redundant. Yes, I do sound like a broken record. Yes, I am going to say it again. Stay home if you're sick. Please wear your face coverings. Wash your hands frequently. Use hand sanitizer when you can't access soap and water. Maintain safe social distancing, a minimum of 6 feet from each other. Avoid large gatherings and get tested. I'm now going to turn it over to our clerk, and she's going to talk more about the voting. Stay safe, everyone, and think about your neighbor.
Thank you, Bobbie. And hello, everyone. I'm Sue Levering, the city clerk, and I am happy to report that we now have our remote location open up at 14 Court Street. And this is for in-person voter registration, and you may also request and receive an absentee ballot at the same time. Located across from the library, you can register to vote, as I said, and receive that ballot, fill it out on-site, or you may take it home and complete it in the convenience of your home and return it to us by mail or in hand at the 14 Court Street location. And we also have a greeter in the back of City Hall. Just want to emphasize again, if you are dropping off your ballot, to please be sure to place it in hand to either the greeter or one of our employees at 14 Court Street. 14 Court Street is open Monday through Friday from 10 a.m. until 4 p.m. We are also offering extended hours on the upcoming 3 Saturdays, Saturday, October 10th and Saturday, October 17th, from 10 a.m. to 2 p.m. And then on Saturday, October 24th, we will be open from 10 a.m. to 12 p.m. October 24th is the last day that you may register to vote in person prior to the November 3rd general election. However, our polls are open from 6 a.m. to 8 p.m., and you can register in person at the polls, or you may register absentee by contacting our office. We will send you a packet with instructions, and you may fill that out and mail it back to us or drop it off to us, and we'll register you to vote. I wanted to just take a moment of your time regarding the absentee ballot process and how to fill out your ballot and secure it in the envelopes before you return it. So I realize many of you are voting for the very first time absentee, and we've received many questions on how to fill it out. So after you complete your ballot, you want to make sure that you take your ballot and you want to put it into the inner envelope, which is an affidavit envelope. It has writing on the outside. Many refer to it as the secrecy envelope. You want to place your ballot and only your ballot inside that envelope and seal it. I've supplied a picture here up on the screen, and you will see the writing of it. On the right-hand side is where you would write in the top, Nashua and your ward number. And then you want to sign and print your name underneath that area. On the right-hand side for disability purposes, or if it is COVID-related and why you are voting absentee. The left-hand side is identical language, but it is for if you are out of town and unable to attend to vote in person. After you fill out your printed name and you sign it. You place that envelope, which again is sealed with just your ballot, in the outer envelope. You seal that one and you make sure that you have your return address on it. And again, mail it to us or hand deliver it to us in person with the city greeter outside Elm Street between the hours of 8 to 5, Monday through Friday, or at a remote location, 14 Court Street, between the hours of 10 and 4. Should you need assistance in filling out your ballot and somebody helps you, that affidavit envelope on the bottom has a section for them to fill out and sign as well. So again, we are located between Monday and Friday from 10 to 4 at 14 Court Street for in-person voter registration and absentee requests. After October 24th, which is the last day to register to vote in person, we will be remaining open at 14 Court Street to continue to receive requests for absentee ballots and let you pick them up there. So if you have any questions, you may contact our office. Our main number is 589-3010, option 5. Our email address is cityclerkdepartment@nashuanh.gov. And you may fax us your requests as well for an absentee ballot at 589-3029. And I will turn this back over to Mayor Donchess, but I would just like to thank all the residents for their patience during these past few weeks. We have received many, many phone calls, at times over 380 in an hour, 2,500 a week. We are answering and sending out ballots as quickly as possible. Close to 10,000 requests have been received. Close to 9,000 or over 9,000 have been sent out, and thousands are being returned. So we thank you for your patience, and we're going to get every ballot out to each of you as quickly as possible, and we thank you again for your time.
All right, well, thank you, Sue, and your staff for everything you're doing to make sure that everyone votes in Nashua. Please make sure you vote either by absentee or in person on Election Day. Now, before we conclude, I wanted to remind you about and tell you about a few things that are going on. Remind you about the census. This is the 2020 census, which is closing on October 31st. We want to make sure that everyone in Nashua gets counted, because the final count has a direct effect on our federal funding for some community programs and services. And we want to make sure that we get every person included. So if you haven't done it, please go online with the U.S. Census, and it takes about 2 minutes to fill out the census form. Very helpful to the community, and of course we really want to know how many people live in New Hampshire and in the United States. We have a few upcoming events. First of all, we have a Ward 4 virtual town hall. I will be talking with residents of Ward 4 about any issues of concern that they may have concerning the city or particularly regarding the neighborhood, and answer any questions you have at the time. So Ward 4 residents, that's on October 15th, and it'll be in the evening. It is a virtual town hall. Of course, we will post on Facebook as to how to connect with us. We have the Mayor's Book Club, which I hold periodically. This will again be a virtual event, and what we're reading this year, or this fall, is The Woman's Hour by Elaine Weiss. Now this is a book, a very exciting and interesting book about the culmination of the women's movement for suffrage that concluded with the successful passing of the 19th Amendment back in 1920. The Woman's Hour focuses principally on the struggle for the last state necessary for ratification, and that was Tennessee, and it went down really to the final hour, one vote. It's a very interesting story, and we have some experts to talk with us about the book, both teachers from the high school and also college-level teachers, 3 or 4 of them who will help us work through and talk about the event. And finally, I, of course, have been holding coffees with the mayor every month for years now. And usually, we used to, but pre-COVID, do it at Jaja Bell's on Main Street. Now we do it virtually. So we will have a coffee with the mayor on Wednesday, October 21st at 8:30 a.m. Again, we will post as to how you can connect with that. Anyway, thank you for your interest. Please stay safe. Continue to exercise caution. Wear your masks. And we will update you again in the near future.